Well, hey there, Myo family, and welcome to this episode of the Myo Minute. I am Carmen Woodland. I'm an orofacial myofunctional therapist with a large online global practice, so I get to help people all around the world with this important therapy. In this episode, I am going to be talking about the complete orofacial myofunctional therapy journey. What a mouthful that is. So a lot of my community members will be asking me, hey Carmen, what does it look like? What's the complete process look like from A to Z? Tell me all the things. And I understand where they're coming from because I'm very much a person like that. I want to see the bird's eye view. I want to know all of this stuff before I'm ready to jump in. So that's what I'm going to do in this episode. So the first step in this process, and remember, this is the process in my company, Impact Myofunctional Therapy. The first step begins with a comprehensive assessment with an exam. So during this visit, we will take a huge deep dive into all of your symptoms, what could be causing A, B, C, all the way to Z, all of your symptoms. We start looking at that. I evaluate 15 or more pictures and videos, 8 pages of intake paperwork that helps paint a picture of you. What's going on with you? I study the intraoral structures, your posture, drinking, chewing, swallowing, breathing, as well as I conduct a functional assessment to see how the muscles are working or not working. For most of you, they're not working. So from there, this journey, it looks like once we do that, you get a comprehensive report. Then you get to select what program you're going to be in. You get your kit. You take a few more measurements, pictures, videos, that kind of stuff. Then you're ready to begin. The real meat and potatoes of your orofacial myofunctional therapy journey, those are your sessions. So each case is going to be different, but the very minimum sessions that we work with anybody is 12. And that's because it takes us at least that many sessions to give you the bare bones instruction that you need. Once these 12 sessions are complete, my friend, you are not done, but we have given you the tools for your tool chest so you can kind of take your journey on your own at that point and continue to habituate and retain those new habits. Now, at the end of your journey, we will complete a final assessment. We're going to look at where you started, where you're ending, all of those things. We're going to hear your final thoughts, get your experiences through therapy, get your final numbers, and then we point your ship for you, as in teaching you how and when to exit or transition out of orofacial myofunctional therapy. So it's a pretty simple process. It takes us about 6 to 12 months. It depends on the program that you choose for your journey. And then we just kind of go from there. So that, in a nutshell, just kind of explains what it looks like, where we start with that exam, and where we end up with a final assessment. So with that said, my friend, if you breathe with your mouth open, if you have your tongue resting in the floor of your mouth, if you suspect you have a tongue tie or know you have a tongue tie, if you snore, if you have sleep apnea, poor sleep, lots of digestive issues, if you're a chronic pain sufferer, headaches, anxiety, depression, general tiredness, lack of energy, no pizzazz, maybe you're having trouble gaining weight, with gaining weight or losing weight, and maybe you have some jaw problems, maybe some ear problems. Those are all things that we work on. So if that's you, we need to have a conversation. We do that by starting with that comprehensive exam that I talked about earlier. And that really is where the rubber meets the road. That's where we look at all this stuff. We talk about what your goals for therapy are, what concerns I have, what concerns you have. Ultimately, what are your goals for therapy? This is your journey. So you're just taking my company along for the ride. We're the ones to support you and give you the results that you desire. But we want to know what it is that you want to fix. So the best way to do that is find your way to our website. Wherever you're watching this video, there's certainly going to be a way to get to our website. You can schedule an exam there, and then we will go from there. The last thing that I ask you, if you know a human that needs to hear this, or perhaps needs an exam, share this information with them, because in addition to us making an impact on somebody's lives, we count on all of you guys to help make an impact as well. So that's it, Fast and Furious. I will be back next time with another great topic, and I'll see you then. Bye for now.